Bird. I work for Halvar University Health Board, but I'm here this morning to talk to you in my capacity as the chair for the West Wales Carers Development Group. It forms part of the Regional Partnership Board here across West Wales, covering the counties of Carmarthenshire, Ceredigion and Pembrokeshire. Now, Avril and I are going to do a little bit of a double act. I know we're challenged for time. Not sure how well we'll do, but we will try our very best. But just to reassure you, we'll be around. We will be here until lunchtime today, and we're really happy to speak to you if you've got any particular questions or queries. So the West Wales Carers Development Group is a group of lead officers with commissioning responsibilities, so using our core budgets from the Health Board, from local authorities and money that flows through from Welsh Government. And we work together along with the RPB Carers representatives who've got an open invitation to join our meetings, and apologies to our third sector colleagues for the omission on my slide because the third sector is represented on our group as well. And we're there to oversee the implementation of both our regional strategy as well as responding to Welsh Government priorities and local needs. And some of you will be aware that we're currently updating our population assessment, and there's a specific carers section within that. So the West Wales Regional Partnership Board published a carers strategy, in fact this time last year, so it's a really great opportunity to reflect on and review some of the progress that we've made against those 4 key priorities that are shown on the slide. And we're going to talk about those individually and just give you a little bit of a flavour of what's been going on. Now then, I was really heartened actually to hear the mention of the Investors in Carers scheme in Rhiann's story. The Investors in Carers scheme, it's a quality assurance scheme. It's based on 6 themed standards, and it's used as a way of auditing and providing evidence of best practice and encouraging organisations, teams, departments to get involved and show their commitment to carers. We've got 3 levels of the scheme: a bronze level, which is just about a general awareness, silver level, and then a gold level, which is really about advanced commitment to supporting carers. And I was absolutely delighted to present Carers Trust Crossroads West Wales with their Gold Award earlier this year in a socially distanced presentation where Alice and I got a little bit wet outside. So this isn't just for health boards, it's not just for social work teams or local authorities. It's actually a scheme that's being used by 118 different teams and departments, and that helps to make sure that the needs of carers are being known across the health board area.
Yeah, just wanted to say something about the local authority social work teams. We have all the social work teams in adult social care have either achieved or are working towards their Investors in Carers schemes, and it's not about the badge, it's really about them demonstrating what they're doing to support carers, and that's the important bit. So we are very keen to take up that award in the local authority. We've also got carers champions in all our social work teams, and we meet every month with Cathy Boyle from the Carers Information Service, and that's where those carers champions and the teams are central points for information, but they also make sure that carers are talked about in the team meetings, that everybody is making sure they're offering carers assessments, and the carers have that profile in the social work teams. So I think it's another development.
And we heard earlier about the numbers of carers that are likely to be in our area. Obviously, it's self-reported caring, but as a health board, actually the numbers of carers that identify to us increased by 64% over the last financial year, and obviously the pandemic has played a key role in people recognising that caring role. So priority 2 was about supporting carers' well-being. So what are we doing to support well-being? Again, it links back to something that's already been said, and we've got a key project across the region called our Carers Discharge Officer Project. It's an ICF, Integrated Care Fund project, so it's using Welsh Government monies, and we've employed through our third sector providers carers officers, and they're located 1 in each of our 4 main hospitals. It was established as a pilot project It's reaping really great and important benefits, and you can see some of the figures for the numbers of carers supported last year. And in this financial year, in the first 2 quarters, so April to September, we've supported 153 individual carers and issued already 302 information packs. And sometimes for carers, that is the level of support that they need. They need the information and know how to access additional support. We also offer, as a health board, looking after me workshops, because it's really important that the carers have that opportunity to consider how to look after themselves. And we have, as a West Wales Carers Development Group, we implemented a regional carers innovation fund, and a number of organisations have benefited from that, including Age Cymru, Holistic Yoga Care, Haval, who've delivered support, and also Carers Trust with their Money Matters project.
And as a local authority, we are represented on the carers networks. I did want to mention one piece of work that we're doing at the moment, because we are part of the mental health carers network, and one of the things that came up from carers who support people with mental health issues is the sharing of information. We know that's a big problem, and carers have said to us, nobody will share information with me, and I'm expected to look after and support this person. So we are now committed to developing an information sharing protocol which sets out information for social workers and nurses to be able to share information with carers. And Beth was right, in the mental health measure, it clearly says there that carers should be involved in the development of those care and treatment plans, and they should see them. But we know that social workers and nurses are a bit nervous about sharing information, so we want to set out that they can do that, and it's right to do that, unless it's, of course, detrimental to the person not to. But we want to make that clear and support staff to do that. And certainly the message I've given to my staff is I would rather be in court for sharing than not sharing. So, I think we should be sharing that information, and we do have that framework to do that. We've gone back so quickly, sorry. Just wanted to say carers assessments, as I said, the champions are there to make sure that people are doing carers assessments, and in terms of our carers assessments, those numbers have increased in recent years. But I would be interested to know if any of you are still trying to get one or having problems with that. Please let me know today. And as part of the Investors in Carers, we've been developing carers information packs in our social work teams. So I know that we've had feedback from carers. They've been quite useful, because information is always something that you need.
So moving on to priority 3, so this is supporting carers who are in education, training or employment. Regionally, we are part of the Carers Wales Employers for Carers scheme, and that gives us access to a range of resources, but also enables our other third sector partners and small businesses to benefit from our membership. As a health board, we've achieved Carer Confident Level 1 award earlier this year, and as a direct result, we've got a specific carers policy, and we're working to roll out our carers passport scheme, because we really do value and acknowledge the contribution that our employees who have caring responsibilities play. And we've arranged and are facilitating a staff peer support network. So Carers Rights Day actually falls on the same day as our public board meeting today, and we will be at public board playing a video of one of our staff carers talking about the support that they've received. We know that there's more to do, but we really are committed to supporting carers in employment.
Just want to quickly mention, we've got to talk very, very fast, haven't we, I think, today, but the Carers Resilience Project, we're working with Crossroads. So I know one of the issues you're concerned about is Respite. Respite has continued, but in a more limited way than historically. And we are still working with Crossroads to provide carers with support. And that there's still capacity, I understand. I think workforce issues are a problem, but we are looking at innovative ways to try and support you. And also we are reviewing, people will know, some of you may have been involved, we were told that our website, our information for carers on our website was pretty rubbish. I think it was not quite as worded differently by some of you. I think somebody said to me it's a load of crap, and you're right, it was. So we're trying to refresh that so you get information online, and we're working on that as well.
Okay, so our last priority was around digital inclusion. There's a huge programme of work going on across the region, funded through the Transformation Programme and Tech-Enabled Care, so providing bespoke and individualised equipment so that people can be supported to access services and obviously reduce isolation and loneliness, which has been a huge issue for many of us throughout the pandemic.
Okay. Yes, and the next slide where it says about encouraging commission service to deliver virtual support, I do need to clarify that doesn't mean the Carers Information Service or third sector who were doing that right at the start of the pandemic. This was about us supporting residential homes, day services to have iPads and equipment. So when people couldn't visit their loved ones in residential homes, we provided technology so that they could link up with their families. So that's what's that about. Thank you.
And just a final slide on some of the work that's been going on regionally. This is not new. It's probably about 2 or 3 years old when we started to work with Swansea University to look at alternatives to Respite and involved carers in different workshops seeking your views. So that report is still coming to fruition in terms of the practical actions, and the pandemic has played its part actually in helping us to think differently about how carers can receive breaks. So for example, for our families who have children with palliative care needs, they're able to access vouchers that would enable them to have a break at Bluestone or at another venue. And I think that's really important because that's actually about trying to be flexible to the needs of the families as well.
Yes, and Chris Harrison, who is the local authority lead in Pembrokeshire and Carmarthenshire for carers, asked me to say that that work is ongoing. It has slowed a bit during the pandemic, but there will be further workshops that carers will be invited to attend to actually start implementing some of those respite options, because there's lots of ways of providing respite, including day services, short breaks. There's lots of breaks and holidays. There's all sorts of ways that we can do better with our respite offer. And I do have to say, from a local authority perspective, pre-COVID, we needed to do better with our respite. Absolutely we did. So even more so now, following the pandemic. So,
Diolch yn fawr. Thank you all very much. It was a whistle-stop tour. I'm sorry if we talked really quickly. And we'd be really delighted to speak to you during the breaks. Thank you.
I just want to say I've got a couple of minutes, because I know one of the things that you were very interested in hearing about today was our day services recovery plan. Some of you I may have met in some of our meetings, because I think that's been one of our biggest challenges during COVID. At the start of 2020 in March, we had to suspend our day services immediately for the safety of the individuals, but we did keep a couple of them open, and right through 2020 we did provide support in some of our day services on a one-to-one basis safely, and also we did provide some support at home. Some of you will have accessed the virtual activities. As I said, one of the greatest challenges and one of our biggest worries is around not being able to have the day services as they were before yet. I would love to be able to say to you we can reopen them as they were next week, but we can't, because the pandemic hasn't gone away. Rates of transmission in Carmarthenshire have been pretty high, and the other thing is we know that people with a learning disability, and particularly people with Down syndrome, are far more likely to get seriously ill with COVID. So as much as we want to get those day services up and running like they were before, we just can't, because we have to prevent illness and death. That's what we have to do. Now, we are increasing the numbers every week. Every time we want to increase the numbers, we have to go through a health and safety assessment. We have to have advice from Public Health Wales to look at safe numbers so that we can try and spread people and staff around the buildings. But we have increased those numbers substantially over the summer. And I know that some representation from carers, when I've spoken to carers or met with carers who have been really struggling, we've been able to find a way around it. So we're swapping staff around, we're swapping people around. Some people have moved to a different day centre just so that we can offer something. But you know, I can't begin to think what it's been like for you over the last 2 years. I know that, you know, we've said it's hard for staff, but staff come and they go, don't they? They go home. But for you, with little or no support in some circumstances, it must have been absolutely horrendous, and I don't doubt that you're exhausted. And you know, we are trying to accommodate everybody that we can, albeit slowly and safely. We just can't open as we were before. What I would say, and I'm sure that some of you will have individual circumstances that you want to talk about, I'm going to be here for the whole day. Please come and find me, because if your social workers are not keeping you up to date, if you're not accessing our monthly meetings, because one of the things when I met with parent carers and carers a few months ago, end of August, people said to me, your communication has been rubbish. And I said, I'm sorry, yes, it hasn't been good enough. I sent out 3 letters, I think, but people said to us, it hasn't been good enough, so hands up, no, it wasn't good enough. So what we did is we set up monthly meetings that everybody who attends a day service, they can come to those meetings, and then we can keep you up to date every month on how we're increasing the numbers and what we're doing. Transport's another issue. We were only allowed to have 1 person on a bus or 2 from the same family. Gradually, we're trying to plan to be able to increase that safely going forward. So it really is difficult, but we are trying to increase every week, and I hope that next year, and I said this last year, that we will be able to do better for you. And as I said, please grab me. I'm going to be here all day if you have a particular issue or a circumstance that you'd like to discuss with me. Thank you.